Vaginectomy, complete removal of vaginal wall. With removal of paravaginal tissue, radical vaginectomy. An incision circumscribes the hymen, and the vagina is marked into 4 quadrants. Each quadrant of vaginal wall is removed by sharp and blunt dissection. The remaining support tissues are inverted and sutured in place, obliterating the space formerly occupied by the vagina. The perineum is closed over the former vaginal opening. Vaginectomy, complete removal of vaginal wall, with removal of paravaginal tissue, radical vaginectomy, with bilateral total pelvic lymphadenectomy and para-aortic lymph node sampling, biopsy. The physician removes surrounding diseased and/or damaged tissue, in addition to removing the pelvic lymph nodes, and performs biopsy of the lymph nodes, the aorta, to check for the extent of disease. Vaginectomy, partial removal of vaginal wall. With removal of paravaginal tissue, radical vaginectomy. The physician excises part of the vagina. The vagina is everted and sizable sections are removed by sharp and blunt dissection. Remaining vaginal and/or support tissue is inverted and sutured in place to obliterate some or all of the space formerly occupied by the vagina. The perineum is closed over the former vaginal opening. Vaginectomy, partial removal of vaginal wall, with removal of paravaginal tissue, radical vaginectomy, with bilateral total pelvic lymphadenectomy and para-aortic lymph node sampling, biopsy. The physician removes surrounding diseased and/or damaged tissue, in addition to removing the pelvic lymph nodes, and performing biopsy of the lymph nodes of the aorta to check for the extent of disease. Colpotomy, with exploration. Colpotomy is an incision in the wall of the vagina. Through a speculum inserted in the vagina, the physician grasps the posterior lip of the cervix with a tenaculum. The cervix is lifted, exposing the posterior vaginal pouch. An incision is made through the back wall of the vagina into the posterior pelvic cavity. Through this opening, the pelvic cavity can be explored using instruments. After exploration, the physician closes the incision with absorbable sutures. Colpotomy, with drainage of pelvic abscess. The abscess in the cavity is located, entered, and drained through the vaginal incision. Rubber drains are often inserted and left in place for several days. The physician closes the incision with absorbable sutures. Hymenotomy, simple incision. The physician performs a hymenotomy. A hymen is a membrane that partially or wholly occludes the vaginal opening. Following local injection of an anesthetic, the physician incises the hymenal membrane with a stellate, star-shaped, incision. Salpingectomy is the surgical removal of one, unilateral, or both, bilateral, fallopian tubes. Fallopian tubes allow eggs to travel from the ovaries to the uterus. Salpingostomy is a procedure in which the contents of the fallopian tubes are removed by making an opening. Oophorectomy or ovariectomy is a surgical removal of one or both ovaries. Salpingectomy, complete or partial, unilateral or bilateral. Through a small incision in the lower abdomen just above the pubic hairline, the physician removes part or all of the fallopian tube on one or both sides. The incision is closed by suturing. Oophorectomy, partial or total, unilateral or bilateral. Through a small abdominal incision just above the top of the pubic hairline, the physician removes part or all of one or both of the ovaries. Salpingo-oophorectomy, complete or partial, unilateral or bilateral. Through a small incision in the abdomen just above the pubic hairline, the physician removes part or all of the ovary and part or all of its fallopian tube on one or both sides. The incision is closed by suturing. Bilateral salpingo-oophorectomy with omentectomy, total abdominal hysterectomy and radical dissection for debulking, with pelvic lymphadenectomy and limited para-aortic lymphadenectomy. The physician additionally removes pelvic lymph nodes and a portion of the lymph nodes that surrounds the lower aorta within the pelvis. Salpingostomy, salpingonostomy. Through a small incision just above the pubic hairline, the physician creates a new opening in the fallopian tube where the fimbrial end has been closed by inflammation, infection, or injury. The procedure is generally performed microsurgically in order to do an accurate repair. Vulvectomy simple, partial. A complete vulvectomy includes removal of all of the labia majora, labia minora, and clitoris. Vulvectomy radical method. The physician removes part of the vulva to treat malignancy. Through incisions in the lower abdomen, thighs, and vulvar area, the physician removes skin, subcutaneous fatty tissue, and deeper tissue. Also included in the en-bloc removal of tissue are portions of the saphenous veins and ligaments and the target lesion. The resulting large and disfiguring defect is usually closed in layers using plastic surgical techniques, which may include pedicle flaps or free skin grafts. Subcutaneous rubber drains may be left in the surgical site, and vaginal gauze packing may be placed in the vagina. Vulvectomy, radical, partial. A partial radical vulvectomy includes partial or complete removal of a large, deep segment of skin from the following structures: abdomen and groin, labia majora, labia minora, clitoris, mons veneris, and terminal portions of the urethra, vagina, and other vulvar organs. Vulvectomy, radical, partial, with unilateral inguinofemoral lymphadenectomy. With bilateral inguinofemoral lymphadenectomy, the physician removes part of the vulva to treat malignancy. The physician also removes superficial and deep inguinal lymph nodes and adjacent femoral lymph nodes. Vulvectomy, radical, complete. A complete radical vulvectomy includes the removal of a large, deep segment of skin and tissue from the following structures: abdomen and groin, labia majora, labia minora, clitoris, mons veneris, and terminal portions of the urethra, vagina, and other vulvar organs. Deep tissue from more than 80% of the vulva is excised. Vulvectomy, radical, complete, with unilateral inguinofemoral lymphadenectomy. With bilateral inguinofemoral lymphadenectomy, the physician also removes the inguinal and femoral lymph nodes. Vulvectomy, radical, complete, with inguinofemoral, iliac, and pelvic lymphadenectomy. The physician also removes the inguinal and femoral lymph nodes on both sides as well as the iliac and pelvic lymph nodes in the pelvic cavity, which is entered through an abdominal incision.